Now an update to a KVUE Defenders investigation. A new state report finds Texas Health and Human Services needs a massive overhaul. The findings come about a week after a KVUE Defenders investigation exposed a mental health crisis in Texas, putting thousands at risk. KVUE Defender Andy Pierrotti has been digging into this issue for months. Andy, what'd you find?
Well, Tyler, the report found that state isn't doing enough to protect mental health patients. Advocates hope lawmakers take action to prevent more people from falling through the cracks.
I actually heard the preacher crystal clear.
It isn't always easy for Alex Pickles to explain what he's thinking, but his mother, Patricia, has a pretty good idea.
A mother knows when something is wrong.
A doctor diagnosed her son with paranoid schizophrenia at 16 years old. Since then, the former Pflugerville school superintendent says getting him help has been a struggle. He's been in and out of state hospitals and jails, unable to get needed resources.
I have gone so far as to ask doctors, if I can't get the help that I need in Texas, tell me what state I can go to. And if I can't get help in this country, tell me what country I can go to.
A new blistering state report echoes her concerns. According to the Texas Sunset Commission, the state's Health and Human Services Commission has, quote, fragmented and poorly integrated programs and services. The state audit also found the agency lacks an organizational unit responsible for looking across the system to ensure the left hand knows what the right hand is doing, serving the same client groups, such as people with mental illness. The state's findings come about a week after a KVUE Defenders investigation found many Texans living with mental illness can't get the resources they need due to inadequate funding, not enough doctors or hospital beds.
I think the recommendations say we see that there's a problem and we know that we need to fix the problems.
Karen Reynes is the director of Austin's National Alliance on Mental Illness.
The truth is that if we can create a system in which we are diverting people from jail, when we are diverting them from crisis situations, we will save money as a community in the long run.
I think the state needs to protect its own citizens.
State Senator Charles Swardner is the chairman of the Texas Health and Human Services Committee. Last month, he told the KVUE Defenders he plans to recommend legislation that could create a standalone agency specifically to help the mentally ill.
Not just mental health, but also substance abuse, and hopefully integration with physical care.
Reynes thinks it's a good idea.
I think that is far overdue, honestly, because I think, once again, it is such a serious, serious medical illness.
I felt emotionally sick.
Potential changes that could lead to more resources to help more families like Alex and his mom. The Sunset Commission recommended consolidating 5 health and human service agencies into one it claims could lead to more comprehensive mental health services. In December, a special commission of lawmakers will vote on those recommendations. Count on KVUE to let you know what happens. For the Defenders, Andy Pierrotti, KVUE News, Night Beat.